I'm proud to introduce Dr. Justin Sanders. Justin is a core faculty at Ariadne. He's with the Serious Illness Care Program, and he's an instructor of medicine at Harvard Medical School and an attending physician in psychosocial oncology and palliative care at the Dana-Farber Cancer Institute and the Brigham and Women's Hospital. And Justin will be presenting the Serious Illness Care Program's COVID-19 Toolkit. Justin?
Thank you, Evan. I'm really grateful to be here to share what I believe demonstrates the very best capabilities of both our team and the lab as a whole. Notwithstanding the traumatic events of the past 2 weeks, this is really an extraordinary time with unprecedented challenges for communities and the clinicians that care for them. These include profound social isolation, collective fear and distress over the risk of COVID-19, and uncertainty regarding its implications, and amplification of healthcare disparities for those who are socially and medically vulnerable. Healthcare professionals are living a traumatic event in slow motion with consequences for our own well-being that are both certain and unpredictable. And we're facing new complexity around communicating risk and uncertainty in ways that are technologically mediated and never more urgent. So over the last 7 years, our program has helped health systems move from reactive approaches to communication to proactive population health interventions. This pandemic presented an opportunity to build on the expertise that we've cultivated and bring it to bear in helping health systems respond to this moment. So I'm going to share with you the process we undertook and the outcomes of that process. Next slide, please. This is the Ariadne arc of design, test, and spread. In this case, we built a team, proposed a scope of work, clarified design principles and values, and adapted our serious illness conversation guide, a tested clinical tool in widespread use. Evidence of its potential utility in response to COVID-19 came in the form of several adaptations sent to us by partners in the early days of the pandemic. Many of these were several pages long, however, and reflected in their focus on life-sustaining treatments a fundamental worry about the need to ration intensive care resources. We realized that where we could add clear value was in developing tools that maintain a focus on simplicity, no more than one page, person-centeredness with primary importance of patients' goals and values in determining care plans, usability accompanied by implementation resources, and evidence through rapid testing and iteration. We obtained rapid feedback from key stakeholders, including clinicians who were willing to rapidly use them in practice. We used the feedback to refine these tools prior to dissemination. And finally, we pushed these tools out into the world with a dedicated website, through social media, using webinars with our community of practice, and direct communication with innovation partners and health systems in our collaborative. We developed and published scholarly products and media that highlighted these tools. Next slide. This toolkit holds resources for multiple settings. We developed these resources to help patients feel informed, prepared, and cared for clinicians to feel prepared and supported to engage clinicians and families in conversations and decision-making, and for health system leaders to disseminate simple, scalable tools and resources that facilitate a proactive communication approach to this pandemic. Our ambulatory care resources include a conversation guide, an implementation guide, video demonstration, and other implementation tools. Similarly, our inpatient guide featured a new guide, a video, and a guide for crisis standards of care. Resources for long-term care and other nursing facilities include a demonstration video and a guide. And finally, we built on work with the Conversation Project to develop a guide for patients and families to use together to prepare and plan. These resources have been translated into at least 6 languages, including some of those spoken in some of the world's emerging hotspots. Next slide, please. Together, we hope that these tools help provide a whole system approach to communication in response to COVID-19. It includes care delivery model components, clinician training and support, and communication tools. As with many aspects of COVID-19, we are looking to apply for funding now to support our evaluation of implementation across the Mass General Brigham system. I just want to finish by saying that high quality communication has never been more urgent. The number of those at risk of dying far exceeds the number of those with serious illness who have been our primary focus in our program. We hope that the tools and strategies that we've developed and disseminated can ease the suffering of this moment for the unprecedented many who face this risk and uncertainty. Thank you.
Justin, thank you so much. It's really been amazing to see the work that the serious illness team has done here, adapting the serious illness guide for COVID. And I know it's been widely used. It's been endorsed by the CDC, and I'm just really proud of the work. You know, when you're designing something new like this or adapting, I'm curious how you feel about, like, what do you attribute the agility and the speed in this situation to be able to move so quickly?
Well, I think aside from sort of absorbing the sheer panic of the healthcare system at large, I think that you know, we were able to really take a pause, which I think is really important, and reprioritize some of the activities that we had going on. I'd like to emphasize the fact that that in taking this pause in a moment of urgency, we were really intentional about sticking to our values. And I think that allowed us to generate products that were not purely responsive to the thing that felt most urgent, which I think at the time of, at the beginning of this pandemic was really about concern about resources and about whether or not we were going to have enough resources. And what we really stuck to was the importance of values and goals driving care as long as possible, and really as has been a core value for us from the beginning. And I think holding on to that actually gave us energy to really work outside of our typical workflows and come together to create something really with a lot of breadth, and that's been very useful for health systems across the country and around the world.
And just, we have another quick question. You know, I think the serious illness program has always been about how to have conversations about goals and values. And you mentioned it very quickly, but we ended up creating also a crisis guide, how to have a conversation in crisis conditions. And I know that was hard to do because the core has always been around communication skills and values and goals. Maybe you could just mention how we managed to do that around the crisis resources.
Yeah, well, we really wrestled with whether or not we should be participating in the creation of a crisis guide, just to say. And yet what we kept hearing from health systems was the need to feel prepared in case that happened, and really to do so in a way that felt compassionate and skillful at the same time. And so I think it was a guide with which we wrestled the most, I think, in terms of how to get the language right, consulting with ethicists, consulting with inpatient colleagues, our colleagues who work in the inpatient setting, to really think about how we could sort of strike a balance between needing to communicate something incredibly difficult, which I think is at the heart of a lot of our difficult communication that we help support with the guides, and also not make that the emphasis of make the restriction of resources the emphasis of the conversation. So that was a real challenge I think we faced in creating that guide.
Justin, thank you so much.
Thank you.